Testing, a non-therapeutic communication technique that is not at all helpful to the client. The nurse may say a question that can force the client to recognize her problem or there is something wrong with her. Now let's take a look and listen on how the nurse may utter this word. Do you know what kind of a hospital is this? Do you still have the idea that you are... In the end, yes, it is true that the client may acknowledge her problem, but it will appraise the client's degree of insight. And testing is a non-therapeutic communication technique. Approval, a non-therapeutic communication technique that gives the clients an impression that he is always right. This is because of a previous communication or an agreement with the nurse. He thinks that his opinion and conclusion will be exclusively right because the nurse agrees with him. And there is no opportunity that he can be wrong. Now, let's witness on how the nurse may utter approval. That's right. I agree with you, and you can never be wrong. In the end, approval will indicate that the client is right rather than wrong. And whenever there's an agreement, this will indicate an accord of the client with the nurse. And this is approval, a non-therapeutic communication technique. Belittling feelings expressed. This is a non-therapeutic communication technique that can be uttered by a nurse. And in this situation, the patient has an intense and overwhelming feelings, and the patient is trying to express that to everyone. But in return, the nurse will also equate that kind of feeling, and he will try to say it, that he has also the same discomfort. And worse is that the nurse may tell the patient that this discomfort can just be temporary, that it can be mild, that it can be self-directed, and that is not important at all. Now, let's try to look at the conversation between the nurse and the patient on how belittling feelings expressed seem to be wrong. The client says, I have nothing to live for. I wish I was dead. And then the nurse says, everybody gets down in the dumps, or I've felt that way myself. In the end, belittling feelings expressed is about misjudging the degree of client's discomfort. The client is focused on his own feelings, and hearing the problems of other people is not helpful at all for the client. That is why belittling feelings expressed is a non-therapeutic communication technique. Challenging, a non-therapeutic communication technique that can be used by the nurse. The problem sets in when the nurse challenges the client to prove any unrealistic ideas. And in so doing, the client will realize that there really is no proof. And he will become able to recognize reality. Now, let's pay attention as to how the nurse can use challenging as a non-therapeutic communication technique. But how can you be president of the United States? Or if you're dead, then why is your heart beating? In the end, the nurse can cause client to defend delusions or misconceptions strongly, even than before. because the nurse will demand proof from the client, and that makes challenging a non-therapeutic communication technique. Defending a non-therapeutic communication technique that can be done or said by a nurse against the client. In this situation, the nurse will say a word or a statement, and whatever she says, the client will try to criticize her statement. And in so doing, the nurse again will defend her statement. And there, the problem sets in. The client will think that as he criticized what the nurse have said, the client will think that he has no right to express his opinions or his feelings. And that the client may also think that his critics or his criticism would always seem to be unfounded and unjust. Now, let's pay attention as to how the nurse will try to defend her statement against the client. I'm sure your doctor has your best interest in mind. As a conclusion, defending will attempt to protect someone or something from verbal attack. And defending becomes a problem as a non-therapeutic communication technique because it blocks further communication between the patient and the nurse. Disagreeing, a non-therapeutic communication technique that is being used by a nurse. Disagreeing will imply at all times that the client is wrong. Now let's pay attention as to how the nurse may utter this word as a non-therapeutic communication technique. That's wrong. I definitely disagree with you. I don't believe that. As a conclusion, disagreeing will seem to oppose the client's idea. And the client in this case will feel defensive about her point of view or her ideas. And that's not a healthy conversation. Disagreeing is a non-therapeutic communication technique. Disapproving, a non-therapeutic communication technique that can be used by the nurse. This always implies that the nurse has the right to pass judgment on the client's thought or actions. Now, let's pay attention as to how the nurse can use disapproving as a non-therapeutic communication technique. That's bad. I'd rather you wouldn't. To sum it up, disapproving is non-therapeutic because it denounces the client's behavior or ideas, and it implies that the client must always please the nurse. Disapproving, a non-therapeutic communication technique. Giving approval as a non-therapeutic communication technique. This can be uttered by the nurse by saying that whatever the patient thinks or feel that the nurse may consider good will imply that the opposite would be bad. Now, whatever the nurse approves of, it will limit the client's freedom to think, to speak, or act in a certain way. Now, let's pay attention as to what the nurse will say as a statement of giving approval. That's good. I'm glad that you did that. I'm glad that you have said that. To sum it up, giving approval can lead to the clients acting in a particular way just to please the nurse. And that's why giving approval at times is not that good as a non-therapeutic communication technique. Giving literal responses as a non-therapeutic communication that can be uttered by the nurses. At times, the client may have or may lost for a word in order to describe her feelings. And whatever she says can be the best word that she can get. But for a nurse, he might be committing a mistake here by literally giving responses to the client's statement. Let's listen to the nurse as he says a wrong or a non-therapeutic comment. The patient says, "They're looking at my head with the television camera." And the nurse said, "Try not to watch television or what channel? It makes no sense." As a conclusion, giving literal responses by the nurse should be avoided. Instead, the nurse should focus on the feelings, responding to a figurative comment as though it were a statement of fact. And that's why giving literal responses is a non-therapeutic communication technique for the nurse. Indicating the existence of external source as a non-therapeutic communication technique. In this scenario, the nurse may always tend or opt to say and ask a lot of questions about the behavior of the client, whether the thoughts or feelings that the client is exhibiting. And let's hear from the nurse as to what are her most common questions. What makes you say that? And what made you do that? And who told you that you were a prophet? In this situation, the nurse is always attributing the source of thought and feelings and behaviors to other outside influences. The nurse does not intend to suggest that the client will get an answer from an external source. And usually, this is what and how the client will reply. In conclusion, indicating the existence of external source is non-therapeutic communication because the patient may be forced to attribute the source of thought, feelings, and behavior to outside influences. Rejecting, a non-therapeutic communication technique where the nurse tries to reject any topic that the client may choose and she closes it from any exploration. The nurse will refuse or not consider any client's ideas or behavior. Let's take a look and listen as to what the nurse will say and how he will say it as a rejection statement. "I don't want to hear about it. Let's not discuss it." Now, in the end, rejecting may let the client feel that she is personally rejected along with her ideas and opinions. And this is non-therapeutic for the client. Rejecting. Requesting an explanation. A non-therapeutic communication technique that tends to ask the client to explain why. Usually, a why question is intimidating, asking the client to provide reason for thoughts, for his feelings, for his behavior, and for the events that he's doing. Let's take a look and listen as to how the nurse will ask the question of requesting explanation. Why do you think of doing it? Why do you feel that way? In the end, Requesting an explanation becomes non-therapeutic because it may cause the client to become defensive on trying to explain him or himself. Using denial. This is a non-therapeutic communication technique where the nurse denies the client's feeling or either the seriousness of the situation, and he does it by dismissing her comments without attempting to discover the feelings or meaning behind them. Let's take a look and listen as to the conversation between the client and the nurse. The client says, "I'm dead." Then the nurse says, "Don't be silly." In the end, using denial as a non-therapeutic communication by the nurse will refuse to admit that a problem exists, and this is non-therapeutic in a nurse-client relationship. Giving advice. Advising means telling the client what to do. And let's take a look and listen as to how the nurse will give an advice. "I think you should. Why don't you?" In the end, giving advice implies that only the nurse knows what's best for the client. And this is non-therapeutic in a nurse-client relationship. Interpreting as a non-therapeutic communication technique. In this scenario, the nurse will try to ask the client to make the conscious that is unconscious. The nurse will try to interpret the thought, the experience, and the feelings of the client in her own interpretation. Let's take a listen as to the nurse uses interpreting as a non-therapeutic communication technique. "What you really mean is, unconsciously you're saying." In summary, the client's thoughts and feelings are his own, and this is not to be interpreted by the nurse for any hidden meaning. Only the client can identify or confirm the presence of his feelings. That's why interpreting is a non-therapeutic communication technique. Introducing an unrelated topic. This is a non-therapeutic communication technique that can be used by a nurse in some way. In this scenario, the nurse may happen to communicate uncomfortably with the patient. This may be because he doesn't know how to respond, or there is a topic that he would like to inject or rather discuss. Let's take a look and listen as to how the conversation will go on between the nurse and the client. And the client said, "Nurse, I would like to die." And then the nurse said, Um, did you do something last evening?" Now, as you may notice, there is an unrelated response from the nurse. And introducing an unrelated topic is non-therapeutic in the sense that the nurse takes the initiative for the interaction away from the client. Making a stereotype comments. This is a non-therapeutic communication technique that the nurse may utter at times. Stereotype comments are those social conversations that may seem to be meaningless chit-chat, and such comment is of no value in a nurse-client relationship. Let's hear it from the nurse as to what are those stereotype comments that she may utter. "It's for your own good. Keep your chin up. Just have a positive attitude and you'll be better in no time." In conclusion, making a stereotype comment lacks value in the nurse-client relationship. And that's why it is considered as non-therapeutic communication technique. Probing, a non-therapeutic communication technique that tends to make the client feel used or invaded. In probing, the clients have the right not to talk about issues or concerns if they so choose. Let's take a look and listen as to how the nurse will use probing as a non-therapeutic communication technique. Now tell me about this problem. I have to find out. Tell me your psychiatric history. To understand it concisely, probing is a persistent questioning of the patient. Probing or pushing will make the nurse discourage the client to talk. And that's why probing is a non-therapeutic communication technique. Reassuring, a non-therapeutic communication technique where the nurse attempts to dispel the client's anxiety. And she does it by implying that there is no sufficient reason for this client to feel anxious or worry. Reassuring indicates that there's no reason for feelings of discomfort for the client. Let's take a look and listen as to how the nurse will utter the reassuring communication technique. Everything will be all right. You're coming along just fine. Just keep what you're doing. In the end, reassuring is a vague reassurance without accompanying facts. And this tends to be meaningless to the client. Reassuring will completely devalue the client's feeling. And that's why reassuring is a non-therapeutic communication technique.
That's all, folks. This has been your Nurse Radiologico Guro saying thank you for watching and enjoy studying.